Hello, thank you for tuning in. Happy Saturday. Let's give it a second as usual. Today we are talking about leaky gut, how it affects somebody who has endometriosis, and also some ways to address it. If you are watching this for the first time, welcome. I'm going to use slides so that you can conveniently save information. The comments will be turned off so that everybody is focused, including my endometriosis brain. And then I will open up the comments after my spiel is over, which will take around 15 minutes, and you will be able to ask any questions that you might have. Great. Well, let's start. Let me get the slides. Welcome, welcome. Welcome. So we're talking about leaky gut and endo. If you can hear me, please give me some hearts. Awesome. Welcome. So I'm going to turn the comments off and start. Welcome to the session on leaky gut and endometriosis. If you don't know who I am, my name is Anastasia Hackler. I'm a board certified coach, health coach, also an endo warrior for many years. My own endometriosis healing journey started back in 2014, and after I finally figured it out, I've been living a pain-free since 2017 without having to go through a hysterectomy or partial excision or even birth control. And for the past year and a half, I've been helping other women relieve their symptoms of endometriosis using a program that I created called 90-Day Endo Hack Plan. English is my second language, so please bear with me. Here you can read about my background. I'm not going to go over that. It's enough about me. Let's talk about the topic at hand. This video is for informational purposes only. It is not intended to treat, cure, or diagnose anything. Always consult with your doctor. So, leaky gut sounds kind of scary, graphic, and very gross. In the scientific community, this phenomenon is referred to as intestinal permeability. It's a tongue twister for me, so I will use IP from now on. Your conventional doctor does not recognize this as diagnosis. But let's face it, those same doctors are trying to treat endometriosis with hysterectomies, pregnancies, and birth control. In the functional medicine world, this term has been circulating since the early 2000s. So there is a lot of articles out there on this subject, and I hope that very soon this will become an official diagnosis, and people and doctors can use it while treating endometriosis. But what is leaky gut, and what does it even have to do with endometriosis, right? Well, first things first. In plain language, leaky gut is when some factors make the lining of your gut weak and leaky, and then pathogens and also good nutrients leak through the gut wall outside. When that happens, your immune system attacks those as hostile because they are where they're not supposed to be, right? That creates a lot of inflammation, adhesions follow, and the worst part is that this can lead to a never-ending immune process dysfunction. And many functional doctors think that endometriosis is autoimmune related. And it happens all in the belly area, so now you have it. Outside of the belly area, the signs that your gut may need some help can be chronic fatigue, a lot of breakouts, autoimmune conditions and issues, food sensitivities and allergies, joint pain, bloat, bathroom problems, depression, anxiety, and so on and so forth. Those are pretty much the symptoms that we experience on a daily basis, right? So that's kind of how it's connected with endometriosis. Also, in the holistic world, there is a trending correlation between leaky gut and endometriosis. There is a study showing that intestinal permeability is abnormal in endometriosis patients, and it might play a role in its development. Another study shows this potential formula for endometriosis, which is we have genetic predisposition plus environmental triggers plus the impaired intestinal permeability equals endometriosis. Trigger warning, I'm going to talk about pregnancy loss. Leaky gut can contribute to recurrent pregnancy loss because it has the ability to change endometrial environment through immune system response. Not fun whatsoever, right? And it is not fun at all because when you start on a healthy diet in the beginning of your endometriosis healing journey, it can become so unpleasant and so discouraging. This is what happened to me when I started on an endo-friendly diet. When I learned about my diagnosis, I was not a healthy food eater before, but I was scared to eat because all of a sudden I became allergic to things that I was never allergic to before. Like this picture with my big lips, it was just after eating an apple. I've been eating apples all my life and nothing like that happened before. Rashes, fever blisters. I was getting fever blister one after the other all over my lips. It was horrible. Even though I was not really eating much because I was scared to get an allergic reaction, I was gaining weight, and that was kind of like a water weight, inflammation weight. My bloat and my acne was totally worse. But what causes this thing, leaky gut? There are different contributing factors. For example, our favorite anti-inflammatory medications, we all take them for pain. And they have been shown to increase our gut penetration rate within just 24 hours of taking it. So can you imagine what long-term use can do? Another thing is hormones. Estrogen and progesterone can alter the barrier function of our gut. And all of us are on birth control. Give me a heart for every year you have been on birth control. My own prescription lasted for 20 years almost. Another thing that we need to take into consideration that can contribute to leaky gut is an imbalance between good gut bacteria and bad ones. Heartburn medications, antibiotics, pesticide residue in foods that are not organic, also sticking to inflammatory diet can shift that balance to the worse. So it can make the bad guys grow. Another thing is stress. And I talk about stress a lot, but did you know that two stress hormones, cortisol and adrenaline, when they are in high quantities, they can actually break your intestinal wall. And if that happens day in and day out, that's not a good thing. So if you're struggling with stress and ways to manage it, reach out. I have some free tools I can share with you to help you manage it better. Then we have oxidative stress from all of the toxins that we are exposed to on a daily basis. And parasites. Why parasites? Because parasites do have teeth. That's how they attach to our gut wall. And when they chew up enough, they can get through and end up on the other side, traveling from organ to organ, carrying whatever they have in their little mouth from organ to organ, and sometimes that ends up being a piece of an endometrial-like cell. That's why endometriosis can end up in different organs. There's a theory on that, and the parasites actually cause bowel inflammations and leaky gut for years. They can cause it for years. On March 1st, this coming Tuesday, I'm opening a new workshop on non-toxic living. We're going to talk about what causes oxidative stress. We'll talk about parasites, pesticides, and whatnot. If you would like to participate, direct message me or comment. There's only 7 spots left. You can do this at your own pace, but you just have to register by the 1st of March. Great. So you know what causes or may cause leaky gut, right? But what do you do if you think you already have it? That's a good question. There are ways to address this. The main mission is to stop injuring the gut so that you can patch up the holes. And to do that, first of all, you need to address stress and hormonal balance so that the injury stops. You need to look into finding some gut-friendly alternatives to manage your pain, manage your heartburn, and manage the infection so that you stop taking gut-damaging medications. Avoid inflammatory foods and drinks as much as you can. Take care of parasites. That is very important. I have different posts on my account about that. Right now in my stories, I'm sharing a parasitic cleanse that I'm going through. You can learn a lot about parasites from there, or just join the workshop that is going to happen soon. You can also supplement with foods that are specifically gut healing. The first food is Bovine Colostrum. Very controversial because it comes from cow, but it's not considered dairy. It is my most favorite gut healer because if you look it up, it is the best right now. Because it contains growth hormones that actually help your gut lining to get rebuilt. So it builds your gut lining. It works pretty fast. Another food is bone broth. It contains collagen, and collagen helps nourish your gut lining and also relieve inflammation. The same thing happens with coconut oil. It helps your inflammation go down, and coconut oil works on fighting the bad gut bacteria. Another one is aloe vera juice. The same way aloe vera heals your sunburn, that's how it works on your gut. So aloe vera is very important. There are some herbs that you can try and supplements. Always consult with your doctor to avoid any interactions, but things like quercetin, it helps strengthen your intestinal wall. Marshmallow root and slippery elm bark, they have this mucousy texture when they get to the gut, so they help coat your gut lining and prevent further damage. And also probiotics so that you can repopulate your gut with good guys so that the balance is good. Awesome. And there are all kinds of other different options that you can use, but you're probably thinking, how long does it take for gut to heal? That's a very good question, and it depends. It depends on the extent of the damage that you have, depending on how many factors you found, and also the tools that you choose to use as healing substances for your gut. It may take somewhere from 4 weeks for some to 6 or even up to a year. It's always good to have an effective plan in place with a professional. Your primary doctor is probably not going to help you much because they're not trained in leaky gut. So always seek help of like a holistic, functional, and alternative professional or a health coach like me. In my 90-day endo hack plan, we are using a safe gut protocol, and so far women have had very good and positive outcomes when it comes to gut health on it. So this is pretty much a lot of information on leaky gut, what causes it, what to do about it, because it is very important. It is very important for endometriosis, because stopping the progression and reversing symptoms of autoimmune diseases, which endometriosis partly is, depends on addressing and healing leaky gut. And remember the formula that I shared with you before: genetic predisposition, environmental triggers, impaired intestinal permeability equal endometriosis. Genetic predisposition is the only thing that we cannot address. We cannot change it, but let's take care of the rest of the equation together. Let's work on that so that we'll eliminate those two so that there is no formula for endometriosis. Thank you so much for watching. I'm going to stop the slides so that you can ask your questions and turn the comments on. while you are coming up with your questions, welcome. Some reminders. So again, if you're struggling with stress and how to respond to it, how to manage it, let me know. I have some free tools I can share with you. I have a webinar that also comes with 15 days of access to me as a coach for free to build your stress program. What if I'm not available March 1st? I think you're asking about the workshop on non-toxic living. If you register by March 1st, you will get access to this workshop for free. You have 30 days to play with it. Everybody else, everybody that joins after March 1st, it will be a paid version. So you can join before March 1st and go through that for free, even if you cannot start on March 1st, if that makes sense. Okay, let me see. Next Saturday, great. I hope. I'm glad. That's what I meant. Awesome. Thank you, Riley J. Next Saturday, we're talking about hormonal balance and ways to address it and kind of what you can do to work on your hormonal balance. You're also more than welcome to send me your topics if you would like me to, talk more about something. If you have any questions or if you get any questions further on this topic, my DMs are always open. Thank you so much for being here with me this Saturday. Have a great weekend and goodbye.